Ωρα Μεταμόρφωσης, ιατρικά νέα, και σήμερα φιλοξενούμε μια γυναίκα θρύλο στην επιστήμη της οφθαλμολογίας. Κοντά μας η Dr Marguerite Mc Donald, η επιστήμονας, η οποία μας έδωσε την ευκαιρία να αποχαιρετήσουμε τη μοιοπία με την πρωτοποριακή μέθοδο λείζερ. Είναι φυσικά μεγάλη μας τιμή για εμάς να συνομιλούμε με την Dr Mc Donald και να μάθουμε τα μυστικά που κρύβει η επιστήμη για τα μάτια μας και μόνο. Dr Marguerite Mc Donald, it is a great honor for the medical TV show Ωρα Μεταμόρφωσης to participate. Thank you so much for this. Hello.
Hi, it's my pleasure to be here and my honor, Glyceria. Thank you for inviting me.
You are a worldwide known ophthalmologist that made a great achievement that all ophthalmologists will dream to live. After years of laboratory and animal research, you were the first surgeon in the world to perform laser vision correction, myopic, astigmatic, and hyperopic photorefractive keratectomies, as well as the first phototherapeutic keratectomies. Dr. Marguerite Mc Donald, we live without glasses because of you. Please, let's go back and share with us this great momentum of your career path. How do you feel about this today?
Well, I'm overjoyed to see what has happened. Back when we were doing this research, we really didn't understand what a worldwide revolution would follow. We said, oh, this is good. We're going to get people out of their glasses. But we didn't realize that it was a landmark in ophthalmic history. So I read the paper by Dr. Steve Trokel in 1983 in the American Journal of Ophthalmology. And I was a very young assistant professor at Louisiana State University, but I knew Dr. Trokel. I went to medical school at Columbia, and we had done some research together. And he had taken a laboratory laser used to make, an excimer laser used to make computer chips in California.
Wow.
And he just passed it over some cadaver eyes, cow eyes, pig eyes. And he said, this has some potential in refractive surgery.
Okay.
And I called him up and I said, Dr. Trokel, remember me? We did research just a few short years ago. I know that you need to go on to do animals. You have no animals in Manhattan.
Okay.
I'm in Louisiana now. I have animals, I have rabbits, I have monkeys, I have everything needed for the next steps. So Steve Trokel in New York, myself at LSU, and Charles Munnerlin, the physicist in California, we began to work together. That's how it all started.
So I realized just now, hearing this story, because we have studied very much your CV and your video and your interviews. So now I realize that you have seen a surgery, and from accident, you realize that this action can be used for a new invention of the ophthalmology. And that is how you invented the laser, correct?
Well, yeah, so Dr. Trokel's paper, he just made random cuts on pig eyes and rabbit eyes, cadaver eyes, and the last sentence of his paper was, this has potential in ophthalmic surgery, because for the first time he was able to make incisions in the cornea with a laser and no surrounding thermal damage, no thermal damage.
Yes.
So that's when the light bulb goes off, and there is no laser in the history of the world before the excimer that could make an incision without thermal damage on the cornea.
Amazing. It is amazing.
So that was the very, very beginning.
Amazing. Marguerite, we all know that medical world, and especially the surgery division, is mainly conquered by men. But you are the glowing exception. Please share with us your experience in this, and how did you manage not only to survive, but to be the protagonist?
Well, in the beginning of my career, it's true, there were no women on the podium. There were no women professors. I was the first female on the faculty in the Department of Ophthalmology at LSU. Very few papers were written by women. I mean, it was a lonely feeling, but you just put your head down and work. You just let your work speak for itself. You don't have to say anything if you're doing good work.
I can understand from your talk that you are very humble. It is amazing. And to let the viewers realize the power of Dr. Marguerite Mc Donald name, allow us to reveal some of your titles. We can't, of course, mention all of them because we will need hours. So, you have been president in many, many organizations, and now we can see in the super all your presidential titles, and you have over 2,000 publications in the field of cornea and refractive surgery. And still, you are, you just said that it's only work. It is amazing for your character.
Well, thank you. You know, just one foot in front of the other, that's all.
Amazing. It is amazing. For your pioneer work in refractive surgery that included the development and performance of the world's first excimer laser procedure in patients, you have received also numerous recognition awards. Dear Margaret, now we have the big question. We want to share with us a soul revelation. Many Greeks and the medical community is watching us. Share with us your success secret. And believe me, it is not only work. Dr. Marguerite Mc Donald, are you a miracle?
Well, I guess just to have a strong belief in what you're doing, not all ideas are good. I've spent some time on ideas that turned out to be bad. But if you know you have a really good idea, just keep plugging away at it every day, plugging away. In the early days of eczema, there were several dark periods where the research almost stopped. Rabbits, for instance, rabbits don't heal like monkeys and humans. And in the early days, we didn't realize the importance of a smooth ablation. So the rabbits had these huge, thick, white hyperplastic scars on their corneas. And in 1 week, my research coordinator and my cornea fellow quit the project.
Wow.
They said, this will never go anywhere. Okay. We are wasting our time. It is too depressing. And they left in 1 week. That was a low point. But, you know,
how did you face this obstacle?
I just said, there's something we don't understand here. Maybe if we make the ablations smoother. And of course, this was all conferring with Dr. Trokel, Dr. Munnerlin, and my husband, Dr. Steve Kleiss, who was on the laser team as well.
Greetings to your husband also.
Yes. And so we decided, let's just try making the ablations smoother. Now, that's so obvious.
You changed the way. And it is very important this, because, you know, when we want to achieve something, and especially the experimental the division, we must have choices and not to insist on some point, only to gain this course.
You know, there will be setbacks, and the idea is to decide, was this a bad idea and I should abandon it immediately, or should I push forward? And we just had the feeling, if, you know, it's so obvious in retrospect that we needed to make the ablation smooth, but we didn't know anything back then. So we said, let's try it before we give in. Let's try making the ablation smoother, and that made all the difference.
Amazing, amazing. You have devoted, Marguerite, your life to study eyes in the science of ophthalmology. I would like to learn from ophthalmology legend, a tip for everyday people. What is that we need to know, to examine, in order to prevent some unpleasant development that concerns our eyes and our vision?
I think the most important thing for all people to know is that if they have good distance vision without glasses,
Okay.
that doesn't mean their eyes are healthy. They could have 20/20 distance vision, but advanced glaucoma, or diabetic retinopathy, or a host of other problems. So the average person thinks that if they see well at distance without glasses, they have healthy eyes. And we need to dispel that notion. We need to tell everyone to get an annual eye exam.
Amazing. Now, I have also a special question for you. Marguerite, have you personally tried out the refractive surgery that you have invented? And if yes, which are the criteria patients should look for in ophthalmologists to trust their eye?
Well, it was always my hope to have laser vision correction.
Ne? Yes.
But it became apparent with time that -11 is too extreme. I was outside the range for laser vision correction.
Oh, amazing.
So -11. However, within the last few months, I have had cataract surgery.
Okay.
I am now 20/15 at distance in both eyes. I'm better than 20/20 at distance in both eyes.
Bravo.
I did not get a multifocal IOL.
Okay.
So I'm wearing reading glasses, but my intent is to use one of the presbyopia drops that will be available soon.
I had a question for this also. Tell me about this. Is there a revolution in this? The drops can help us, or it is a myth?
Yes, and I have to say, apologies. It's spring here, and my allergies are out of control. I apologize. So yes, there is a presbyopia drop that is approved in the United States. It's called Vuity, and it's a re-engineered form of pilocarpine, 1.25%. And you take it once a day, and it gives you good near and intermediate vision for 6 to 10 hours.
Wow.
But it does pull a little, it does contract the ciliary body. No one in the clinical trial was above -4. So there are some drops coming very soon that, like phentolamine, that do not contract the ciliary body. They make the pupils smaller, but they would be safe for high myopes like me. So even though I have perfect distance vision now, I still have a myopic eyeball. I still have a long myopic eyeball, and I'm at heightened risk for a retinal detachment. So I'm going to wait for the drop that doesn't contract the ciliary body.
The magic drop, that can save all the people that are, because in the 40, when you are 40, the presbyopia comes and changes the status of your life. It is amazing.
Yeah.
But now, with the technology upgrade, and from you, all the ophthalmologists that really believe in the innovation of technology, all the people can be saved. Let's go to another most common eye diseases that here in Greece, in Europe also we have, and especially the spring. It is the dry eyes and blepharitis. We have studied at the Aegean cornea before some years that was planned in Mykonos, that you were also, of course, organized it. You have presented the depth theory, dry eyes and blepharitis syndrome. Can you please elaborate on this? Because we have a product here in Greece, the Naviblef, tea tree oil cleanser, that you have presented also widely for dry eyes and blepharitis. And why it is so important to use that kind of pharmaceutical products?
So there is a biofilm. Most bacteria exist in a biofilm.
Yes.
Most infectious diseases, 65% of infectious diseases are caused by bacteria that live in a biofilm that is composed of polysaccharides. It is the perfect nutrient solution for bacteria. So biofilms help bacteria. They help viruses. Biofilms help mites. So if you can remove the biofilm, you are removing the substrate, the food for all these organisms. And it's important to remove that because it recollects very quickly. So in the United States, we advise that people do lid treatments with something like ophthalmogen or Naviblef at least twice a day, and severe cases 3 times a day.
Yes.
And they contain natural oils that are toxic to the exoskeleton of the mite and also destroy the polysaccharide biofilm, making reproduction very difficult. So they're an important part of our treatment of any patient with ocular surface disease, but especially if they're headed to surgery. If they're going to have LASIK or cataract surgery, you have to treat their ocular surface disease first, or the pre-op measurements are unreliable. They will have a rocky course and a greater chance of endophthalmitis for the cataract patients, which is our most serious complication, and a greater chance of a post-LASIK infection, or a host of other complications. So treating the ocular surface has become important for all surgeons, whether they are interested in the ocular surface or not. This is sort of forcing us all to become interested in the ocular surface.
Yes, Naviblef, of course, is doing this activity, and you have also mentioned ophthalmogen. From my beloved husband and your friend John Chakales, who has invented this kind of innovative formula that really can, this is a gel that can be used in the eyelids and the eyelashes. And because Demodex, that you have also mentioned, is mainly now in our lives. We know this, category. And this gel contributes to the control of the bacteria biofilm also.
Yeah, I mean, and it is possible to obtain these products in the US. And as you see here, they are available here. You can get anything on Amazon. And they're highly effective. They're also, besides being anti-mite, antivirus, antibacterial, they're calming. They soothe inflammation. They reduce irritation and redness.
Amazing. You know, we know very well that you love Greece, and you are always participating in the organization committee with Dr. Ioannis Palikaris. This summer, we are going to have a Aegean corner in Greece also?
We're going to have it in 2023.
Okay.
And I must say, Dr. Palikaris is world-renowned, the father of LASIK.
Yes.
He developed LASIK about a decade after PRK, a giant in his field and a dear friend of ours and a collaborator on many projects and papers. So LASIK was born in Greece. You should all be very proud of this.
We are, of course we are, for Dr. Palikaris.
Yes.
So, the most famous...
Next year, do it again.
Sorry?
I said, next year we'll do it again. It'll be Aegean cornea next year.
And we will also cover this this event. The most famous ophthalmologist, Marguerite Mc Donald, the most famous opinion leader in ophthalmology. You are the most suitable person to give us a hint for the future of ophthalmology, Marguerite. How do you see the future? Are we going to have transplantations of bionic eyes? This is very important for your answer for us.
Artificial retinas and retinal transplantation are already in development. They are a few years off. But for instance, retinal translocation, where a piece of the retina is translocated to another part of the patient's same retina, same eye,
okay,
that's been under development for years. I think bionic retinas will follow, but first it will be transplantation of human retina, then bionic retinas. Bionic eyes, that's a little further out, but nothing is impossible.
Of course.
I think for sure, in 25 or 30 years, there'll be bionic eyes, if not sooner.
Of course, you have everything is possible. Imagine that you was the first person that made us live without glasses. Dr. Marguerite Mc Donald. It was a great honor. It was an honor for me to meet you on air. I can't wait to see you next year in Greece. Thank you very much for your participation.
Thank you, Glyceria. Hope to see you soon. Bye-bye to all my friends in Greece.
Thank you so much. Ciao.
Ciao.